Thank you. I'm going to bring it back to the committee for questions or comments. I'm going to bring it back to the committee for questions or comments to be able to allow some members to be able to offer insight. Assemblymember Schiavo.
Thank you, and my apologies. I presenting 6 bills today. I got to go chair a committee shortly, but I did want to ask some questions and make some comments. And I have some questions for the sponsor, but first I wanted to ask opposition. If you could just clarify, you were talking about the $500 billion. What is that out of the study that was commissioned by the Healthy California for All Commission by UC Berkeley Labor Center?
That was the Legislative Analyst's Office analysis of the prior single-payer bill.
Right. So I think where that number is coming from, and I just hope that we can clarify that here, is actually stating what the cost of healthcare will be over 10 years if we do nothing. That's the current cost of healthcare. So that is not necessarily the cost of implementing a single-payer bill. That is the cost that we are already going to be paying for healthcare, and that study was based on from 2020 to 2030. So that 10-year, we're kind of in the middle of it, and maybe an update would be a good idea. But I think that they're referencing it. So, that same study said that we would actually save $152 billion over that 10-year period. Nearly every study that has looked at single payer has said that we will save money. It's not really debated at this point. It will save money. It will cover everyone. Those are the basic tenets of single payer. And we know that, and we see that happen in other countries. And while you quote, wait times in other countries, which I would dispute, we have wait times here. And as someone with decent health insurance, I have had to wait months when my insurance calls me and says I need to come in. They don't even have an appointment for me, and they're telling me I need to go in. And we have people who can't afford to use their insurance, and they're waiting until they die. We are the only country where people go bankrupt, and it is the number one reason for bankruptcy is medical bankruptcy every year, year after year, since I can remember working on this issue, which has been over 15 years. So we don't have that in other countries. And I understand concerns around the budget right now. I would have really loved for this to pass when it was $1,400, and when we had a budget surplus of billions of dollars, been able to set aside money to really start this program, because hopefully we would see the fruition of those savings coming in years going forward that we actually really need right now. But to say that that we want to continue to tweak around the edges, I think, is short-sighted. And anyone that I talk to in healthcare sees a fiscal cliff ahead of us that we cannot afford. Our healthcare system is unaffordable, and we know that that we have to make a change. This is the only one that saves money and covers everyone, prevents death and prevents bankruptcy. And if people want to go figure out how much they could save, there's a convenient calculator on Healthy California website, the Healthy California Coalition website, that actually can help people calculate those dollars. When it comes to business, I would there's a phenomenal documentary called Fix It, and it's a series. And the first one really focuses on what businesses would save. I'm a small business owner. I come from a family of small business owners. My parents in their small business would pay for health insurance for my dad's one employee before they paid for it. We know that covering the cost of health insurance for businesses, especially small businesses, is crushing. It is crushing them. And so when you look at this issue for businesses, I think that this is actually a huge benefit for them, and something that they are desperately looking for change and improvement on. And it's one of the reasons that we have huge businesses like Amazon trying to create their own healthcare system, because they are so frustrated with the high cost of healthcare, right? I do have some questions that I want to ask the sponsors, and and better understand some of the thinking on the bill as well. And I know that AB 2200 directs the state administration to apply for federal waivers, and it does not in any way constrain what the governor negotiates with the federal government. And as a result of those negotiations will be applied by a CalCare governing board who will have complete authority to design and implement the program. I know in the last iteration in 1400, the program would come back to the legislature at a point. It looks like that's taken out in this iteration of the bill, and I just wanted to better understand the lower involvement from the legislature and what the thinking is there.